So as you're aware, the government has been implementing the multi-sector approach in relation to the response towards cholera. And this has involved a number of key pillars that the government has relied upon based on a comprehensive, robust and holistic intervention that deals with a range of underlying factors that fuel the current cholera outbreak. So the first instance, there's a dealing around case management. The government focused on clinical care, provision of medical products in order to address the cholera ailments. So this is basically from the clinical care side, and this is being spearheaded by the Ministry of Health with support from all other entities, including the Disaster Management and Mitigation Unit. The second pillar involves itself with WASH, which essentially is water, sanitation and hygiene. And here the government has installed at least 240 10,000 litre tanks across cholera hotspot areas. In essence, the government is delivering at least 2.4 million litres of water on a daily basis in order to provide clean drinking fresh water to the afflicted areas. Under WASH as well, in the aspects of sanitation, the government is emptying pit latrines. So as you're aware, the idea is to ensure that drinking water does not mix with fecal matter, and places are kept in very conducive sanitary conditions. In addition to solid waste management, the government is through the Ministry of Local Government and Rural Development undertaking the directive that the President has put in place, which is basically to bury all shallow wells. So before shallow wells are buried, what the government has done, we have super chlorinated the shallow wells to make them not conducive or fit for purpose, and then bury them. So it's a very laborious undertaking, So that tells you about the gravity of the problem in terms of challenges of the informal settlements and how difficult it is to provide that level of service and care. Outside of solid waste management, the government has mobilized about 100 vehicles for the relief operations in case management, in WASH, in solid waste management, and all the entire aspects of relief provision insofar as cholera is concerned. In addition to the transport and logistics component, the government is also involved in risk communication and community engagement. And what this involves is basically engaging communities on aspects of cleanliness, on messages of hygiene standards and so forth. So messages have been sent out in public media, print, televised media, broadcasted media, and so forth. Text messages have also been sent out through Zixa and mobile. Outside of the media component of risk communication and community engagement, the government has also engaged the Ministry of Youth, Sport and Arts, spearheaded by the Ministry of Youth, Sport and Arts. We've got the National Arts Council, which has engaged various artists, drama groups and so forth, who've gone in these communities to speak the language that communities can relate to and understand. And in doing that, what essentially is happening is that there's very, very good feedback from these communities, because now there's that ownership of the preventive intervention that we want to put in place. In addition to community engagement, risk communication, there's also been a very wide-ranging distribution of chlorine to the hotspot areas, just to help with the aspect of hygiene and treating of contaminated water sources. Happy to report that despite the loss of lives, which are regrettable, in excess of 600, and we have about 19,000 cases cumulatively, the government has also been quite proactive in ensuring that most of the cases that have been brought to the facility have been controlled and most people have been discharged. That's the broader initiative in relation to cholera.